Hello, good afternoon everyone and welcome back to my channel. Today I would like to get to everyone's notice about certain red flags that we usually encounter in our pediatric practice. These are the warning signs and symptoms that parents always should look ahead in their children. So I'll discuss with you in brief about what are the points that should be kept in mind as the red flags so that the children can be immediately brought to the hospital in case of an emergency. The first point is a child who is lethargic, dull, decrease in activity with poor feeding. This indicates a underlying serious condition. It can be from a simple condition like a dehydration to a more serious condition like infection of the brain. So a lethargic child, dull child, not eating well, not playing is a child that you should be looking at and immediately brought to the hospital for medical attention. Any fever of more than 104 in any child should be considered as an emergency. This is my second point. Any fever of more than 104 has got a detrimental effect on the system, on the human body, where the child can have seizures or fits, and this can lead to a lot of serious complications. It can also represent an underlying serious problem like an infection in the brain or the lung or the kidney or somewhere else. A severe bacterial infection or a viral infection with a fever of 104 should be cautiously dealt with, and the child should be immediately brought to the hospital for the care of medical professional. For any child, especially for those newborn children or below 1 year, a temperature of less than 96, what we call in our medical term as hypothermia. So a fever of below 96 is considered as a serious condition. This also indicates an underlying serious problem like infections, and the child should be immediately brought to the care of the hospital. Any child who has a respiratory difficulty, shortness of breath, breathing difficulty, more respiratory rate should be considered as an immediate emergency and brought to the hospital's attention, brought to the medical professional's attention. This also indicates an underlying problem with the lung. Maybe this could be an acute attack of asthma or pneumonia, etc. So any shortness of breath, rapid breathing should be considered as a high priority, and the child immediately got to the hospital for a checkup with a pediatrician. Development of rashes all over the body. It could be small dotted rashes or large patchy rashes. Development of a rash is considered as a medical emergency, especially when it is associated with fever, and the child should be immediately brought to the hospital for a complete examination by the pediatrician. It can be a simple problem like a viral rash or a more complicated problem like a bacterial infection, or also dengue can have fevers with rashes. So these all should be considered, and any rash with or without fever should be checked up by a pediatrician. So having vomitings is quite common, but a greenish vomiting will indicate an underlying intestinal problem like an intestinal obstruction, and this is a medical emergency which has to be checked by the doctor as fast as possible. It needs to be evaluated with certain set of investigations, and also along with this some sort of medication is also required, and a further evaluation like an ultrasound test has to be done to find out the real cause of the greenish vomit, because it can represent a silent underlying problem. Vomitings which can be excessive, so non-greenish vomiting but excessive vomitings, let us say more than 7 to 8 times in 1 hour or more than 10 times in a day, which is again leading to lot of dehydration, weakness, a dull child should be immediately brought to the attention of the hospital. When you examine a child, when you touch a child, a cold extremities, cold hands, cold legs is an indicative of low BP, and this child has to be immediately brought to the hospital for checking up the vitals, as well as to find out is there any other underlying condition for the present complaint of cold clammy extremities. Cold extremities also denote underlying infection, which in medical terms we call it as shock. So this septic shock can be because of some underlying bacterial infection in the blood, and this could be serious if it's not treated well. Another very important marker that I would like to tell to the parents is about the urine output. Urine output is a very good indicator where we see the status of hydration in the body. So urine output, if the child is not passing urine for 4 to 6 hours associated with fever or loose motions or vomitings, should be considered as a sign of dehydration and immediately brought to the healthcare professional's attention. The next point is bleeding from any site. Bleeding from any site should be considered as a serious condition because it can represent an underlying serious problem and immediately brought to the attention of a medical professional for a thorough evaluation, examination and the correct treatment. If by chance you examine a child, you feel the child, you touch the heart rate near the heart, near the chest, and you find that the heart rate is excessively more, this has to be brought to the attention because this can represent a serious underlying condition called as supraventricular tachycardia. And lastly, a limping child or difficulty in walking. This is also a serious condition where it has to be examined thoroughly by the pediatrician. So my dear friends, please remember all these red flag signs in the house, what you are supposed to know and when to get the child to the hospital for an immediate medical attention. I would repeat once again for you, a lethargic, point number 1, a lethargic child, dull child, not eating well and decreased in activity. Second, fever for more than 104. Third, fever less than 96. Fourth, shortness of breath, breathing difficulty, rapid breathing rate. Fifth, development of a rash. Sixth, greenish vomiting. Seventh, excessive vomitings that would again lead to dehydration. Eighth, cold upper limbs and lower limbs on touch. Ninth, decrease in urine output for more than 4 to 6 hours, no urine output. 10th, bleeding from any site of the body, be it mouth, be it ear, be it from the anal region or the urinary tract. 11th, increase in the heart rate, and finally 12th, a limp child and inability, difficulty to walking child. So please remember these red flag signs and get to the attention of the healthcare professional immediately if you have ever noticed them. Thank you.